Good afternoon, David Rockwell. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you could do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your roleplay.
It sounds like you're going through a bit of a rough time with this nose scab, Mihiraa. I understand it can be quite bothersome. My name is David Rockwell, and I'm the nurse who will be assisting you today. Now that I've had a chance to examine your nose, I'd like to spend some time discussing it further to understand what might be causing it and what we can do to help you feel more comfortable. We'll also talk about some ways to prevent it from happening again. To start, could you tell me a little more about this scab in your nose?
Well, I first noticed it about a week ago. It's not the first time, no. I've had scabs in my nose on and off for a few months now, but this one seems to be taking longer to heal. Usually, they go away on their own. I haven't really tried anything specific, just left it alone.
I see. It's helpful to know this has been a recurring issue. Now, I'd like to know a bit about your general health, as sometimes these things can be connected.
Yes, I do tend to have dry skin, especially in winter. And I do get hay fever pretty badly during spring and summer, so I'm often sneezing and blowing my nose then. No new medications, though. Just my usual allergy tablets when needed.
Thank you for sharing that, Mihiraa. That gives us a clearer picture. There are several common reasons people get scabs in their nose. It can sometimes be due to minor nosebleeds that clot, or simply very dry air, especially during winter months, which you mentioned. Frequent nose blowing or irritation, and even nose picking, can also contribute. Given what you've told me about your dry skin and allergies, how do these possibilities resonate with you?
That makes a lot of sense, actually. The dry air in winter definitely affects me, and with my allergies, I'm constantly blowing my nose. I also have to admit, I sometimes pick at my nose, especially if it feels crusty.
It really sounds like we've pinpointed what's going on, Mihiraa. Given everything you've told me about your dry skin, allergies, and even the occasional nose picking, it's highly likely that dry nasal passages and irritation are the main reasons you're experiencing these scabs. The good news is that now that we understand the likely cause, we can focus on some really effective ways to prevent them. The most important thing you can do is to keep your nasal passages moist. Think of it like moisturizing dry skin. Your nose needs that same kind of care. This means consistently using a saline nasal spray. It's just salt water, so it's very gentle, but it makes a big difference in hydrating the delicate lining of your nose. Also, using a humidifier, especially in your bedroom at night, can add much-needed moisture to the air you breathe, which will really help, particularly during those drier months, or if you live in a dry climate. Does that make sense?
I've heard of saline sprays, but never really thought about using one regularly. And I don't have a humidifier, but I can see how that would help with the dry air.
Excellent. To help improve the condition of the scab and prevent new ones, I'd suggest continuing with regular saline sprays. They're very effective for keeping your nasal passages hydrated. You could also try applying a small amount of petroleum jelly or a specific nasal gel with a cotton bud just inside your nostrils. This creates a protective barrier and helps with healing. What do you think about trying these?
That sounds easy enough to do. I'll definitely give the saline spray and petroleum jelly a try.
That's great to hear. Now, while these measures are usually very effective, it's important to know when to seek further medical help. If the scab persists despite these measures, becomes more painful, starts bleeding frequently, or if you notice any signs of infection like increased redness, swelling, or pus, then it's crucial to see a doctor. Do you understand when you should be concerned?
Yes, I do. If it gets worse or doesn't go away, I'll know to come back.
Exactly. And finally, I would recommend making an appointment with your doctor. While we've identified some likely causes, it's always best for a doctor to rule out any other underlying problems or causes that might be contributing to this persistent issue. How does that sound to you?
Yes, I think that's a good idea. I'd like to get to the bottom of it.
Perfect. We can help you schedule that before you leave today. Do you have any other questions or concerns for me at this point, Mihiraa?